Everybody knows that the NHS went into this crisis after years of underfunding. Everybody knows that the NHS went into this crisis with capital budgets having been repeatedly raided, which has left hospitals with a £6 billion repair bill. The NHS entered this crisis after cuts to around 15,000 beds have been cut since 2010 in the National Health Service. We've entered this... Of course we'll give way.
We can't let this stand. What a load of nonsense. The NHS went into this crisis with the highest funding level in its history, with more doctors than any time in its history, with more nurses than at any time in its history, with the biggest hospital building programme in its history. The investment from this government in this NHS is the highest that has ever been made by any British government in history, and that's why it's only us who are the party of the NHS.
The National Health Service has been systematically underfunded for years under this Tory government, and the NHS went into this crisis without adequate levels of PPE for frontline staff, with nurses using curtains and plastic bags to protect themselves on the wards in the face of this horrific virus. They're sighing. They sent our staff into the face of danger without the proper protection. That's what happened in this crisis because of years of cutbacks and underfunding in the National Health Service. Cutbacks and underfunding, which meant we've lost 15,000 beds in the National Health Service since 2010. Cutbacks which meant that our public health budgets have been cut by 800 million under this Tory government because of years of austerity in the NHS. We've got people with serious mental health problems who will be spending this lockdown in Victorian-style mental health dormitory wards because of the cutbacks to capital funding over years. That is absolutely true.
The honourable gentleman mentions dormitories in mental health services. Dormitories have plagued mental health services for years and years and years. And which is the first government that has not only committed but put the funding in to end dormitories in mental health services? This Conservative government. It isn't only that this government is the government for the NHS and we're the party of the NHS. We are the party investing record sums into mental health services, with the biggest increase of all the increases in funding going into mental health services, including ending the dormitories in mental health services that have existed ever since the NHS was created.
We've been cutting capital budgets in the NHS, which is why we've still got these horrendous dormitory wards at Leicestershire Trust, Derbyshire Trust, and for years because of Tory cutbacks. Because of years for Tory cutbacks, we have had CCGs raiding the budgets of child and adolescent mental health budgets in order to fix the wider revenue gaps in the NHS. That is because of 10 years of underfunding in the National Health Service, and we went into this crisis with an NHS which didn't have enough staff, short of 80,000 staff in the NHS, which has seen 15,000 beds cut, which has seen public health budgets cut by 800 million, which has left hospitals with £6 billion worth of repair bills, with dormitories in these Victorian wards which haven't been updated for years. He cannot stand there and say that the NHS had enough investment going into this crisis, because if it had, we wouldn't have had staff without the PPE